Well, good morning, everyone. We so appreciate being here. For those of you who don't know me, I'm Kim Friddell. I'm the director of the Office of Preschool Education Programs. I'm going to have my team that's with me introduce themselves as well. Corinne, you want to go first?
Good morning, everyone. My name is Corinne Brown. I also work in the Office of Preschool Programs, and I work with Bergen and Middlesex Preschool Education Programs, and I work with Bergen and Middlesex County.
Dina?
Hi, I'm Dina Watson. I also work in the Office of Early Childhood Services, and I'm the liaison for Ocean and all charters that has preschool.
Kim, if I could just jump in real quick and let everybody know that we do have the Q&A enabled. So if you have any questions as they go through their presentation, feel free to drop them in the Q&A. And if we have time, we'll ask them at the end of their presentation. And if not, I will send them over to their office and they could respond, and I'll send out the answers to you all after the call.
And Mickey, did you want to say hi?
Oops, sure. Hi, everybody. Good morning. Mickey Ronan Grosstern, Executive Director of Early Childhood and Director of Childhood of Preschool Expansion. Nice to see everyone.
So we are here this morning to just kind of talk about the Mixed Delivery Handbook. Okay. There we go. I'm going to get through this. So the Mixed Delivery Handbook is a user-friendly document, or we hope it's a user-friendly document, that compiles all aspects of operating the PEA program. It was developed to be a resource for licensed child care providers, Head Start programs, both those who are currently providing the preschool program with contracts with districts, as well as providers who may not currently be in those relationships. But it's also a resource for parents and other stakeholders. As you all probably know, the state-funded preschool program is very complex. It has a lot of components in the implementation. So we really want to have a document that pulls things in one place and is a little bit user-friendly than just regulations and other formal documents. I do want to point out, though, that beyond just this handbook, within our website on the preschool section, you can find many supplemental guidance documents as well as the DOE regulations. So we have a variety of documents on different topics that go more in depth than just the handbook. So there's guidance on field trips. There's guidance on health and safety. There's a video series on the role of the PERS, the preschool intervention and referral specialist. So I do encourage you to look at the website as well if there's more things that you want to have a bit more information on. So I want to just talk about how we got here. So Governor Murphy I believe it was around 2022, maybe it was 2021, he wanted to have a study on a strategic plan on universal preschool in New Jersey. NIER, the National Institute for Early Education Research at Rutgers University, was given an MOU to develop the document, which was phase 1, and that was released in 2022. There was then a second phase that was released in 2023. One of the recommendations in those strategic planning documents was the development of guidance and templates to help child care centers partner with districts more effectively. We also then this summer, July of 2025, the Universal Preschool and Kindergarten Act was signed by Governor Murphy. I'm sure many of you are aware of this. So it requires districts to do due diligence in identifying childcare and Head Start partners. It allows for making sure there's equitable access and prioritizing students who have, I like to say, that are at success as opposed to at risk. But making sure that those children are part of the prioritizing of getting placed in classrooms. There was a second piece that allows districts to enter into multi-year contracts with providers if they would like to do that. Then the last thing that I will say is that the creation of the Mixed Delivery Handbook was also part of that Universal Preschool and Kindergarten Act. In January of this year, we were able to release the Mixed Delivery Handbook, which is before you today. Okay, I am going to now turn it to Corinne.
Hi, everyone. So I'm going just to jump right on in and just kind of go over some of the benefits of mixed delivery, which you may already be aware of. But first, it expands access to high quality preschool and broadens the preschool landscape to ensure that all of the eligible 3 and 4-year-old children in funded districts can attend a high quality program. It also helps reduce the early achievement gap by supporting strong early learning experiences across all settings. And finally, it provides family with choice that meet their needs. Many families need flexibility like before or after care or summer options that working with providers in Head Start locations can provide. Next, I'm going to go over just some of the handbook sections overview, not deeply, but we'll just summarize what the different sections contain. So first, we have the collaboration guidance. So in the collaboration guidance, it explains how districts, private providers, and Head Start programs work together to implement the preschool programs, outlining expectations for partnerships and shared responsibilities. Every community has a different approach to how you would approach a district. So we don't have any guidance on specifically how you would approach a district, but that could be through reaching out to a letter to the superintendent, attending a board meeting. Some districts may want you to contact the early childhood department, but we do encourage you to read over the Mixed Delivery Handbook so that you have the most knowledge and understanding of the program. So when you express your interest, you can back up your interest with that knowledge and expertise. And the district will be there to collaboratively work with you to help you understand what the requirements are. The next section is communication. So that covers required communication systems between districts and providers to ensure consistent coordination, problem solving, and information sharing, because it is such to make it an effective communication so that you're jointly working together to communicate all issues and just collaborate with one another. Next, we have personnel and district support. So this describes the district level staff roles like administrators, instructional coaches, support personnel, and the guidance they provide to ensure high quality program implementation across settings. Then we have the provider and Head Start program center positions, which it outlines the staffing requirements for private providers in Head Start, including directors, teachers, and assistants who must meet the NJDOE qualifications and licensing standards. Then we have program operations, which details operational requirements such as daily schedules, classroom structure, enrollment processes, and compliance with state regulations to maintain consistency across programs. Next, we have program planning, which provides guidance for annual and long-term planning, ensuring that programs align with state expectations for high-quality preschool and meet community needs. We then have curriculum, instruction, and assessment, which explains the expectations for developmentally appropriate curriculum implementation, teaching methods, assessment systems, all required in mixed delivery classroom settings. Next, we have program evaluation and professional development. So this describes the evaluation processes and also the continuous improvement practices, along with requirements for ongoing professional development for teaching staff in all settings. Next, we have contract guidance. So in this section, it covers how districts must contract with private providers and Head Start programs, including expectations, required components, and legal obligations. But you can also view the contract online. We have a Head Start contract template and the provider contract template, and that will give you the legal requirements of what's in the contract. And then in the handbook, we have more guidance on specific areas that may need more explanation. Then we have budget and finance guidance, which outlines funding structures, including how preschool education aid is allocated and how providers are compensated based on county per pupil rates. Next, we have federal compliance, which summarizes federal requirements that all participating programs must follow. So that's aligning with early childhood education laws and regulation. And finally, we have state compliance, which provides state-specific regulations, including administrative code requirements that programs must meet to operate within the New Jersey's high-quality preschool systems. And finally, we have just the key elements of the mixed delivery model. So that's collaboration, access, family benefits, funding, and quality standard. And all these things in the mixed delivery preschool model, they strengthen New Jersey's commitment to providing every 3 and 4-year-old with access to high quality early learning. Through these partnerships among districts, providers, and Head Start programs, the state expands preschool capacity, increases family choice, and ensures consistent quality across diverse settings. By aligning standards, providing preschool education aid, and supporting collaboration, New Jersey continues to build a unified, equitable early childhood system that benefits children, families, educators, and communities. We also just added the QR code to here. So if you wanted just to scan that, just so you can quickly get to the handbook, you can do that as well. But that concludes the presentation.
So thank you, Corinne. And I don't know, Cindy, I'm going to figure out how to stop sharing. And I don't know if there are any questions. Or can you stop me sharing, Cindy? I don't know.
Okay, there was only one question. Where can I find the handbook? Up at the top, Kim, you should see a little stop share box. Maybe.
I do not.
It's okay, because they asked for the QR code to go back for a second.
Okay, so let me go back. And when we leave, I guess I'll stop sharing.
There you go.
I think the share
There you go.
bottom of the screen. For me, it's on the bottom anyway.
Yeah, I see share, but I don't see stop sharing. But let me see if I can get back.
Yeah.
Wow. I need a Zoom tutorial. Dina?
All right, just go on your PowerPoint and just hit the back, on your keyboard, just hit the sideways. Yep. Now go, yep. Click on it. Share, make it big. Yep.
There we go.
Dina's my tech support. She saves me from myself.
And I think to stop sharing, just hit on the share screen again. Just say share screen. It'll stop you from sharing, I think.
We will also send that handbook out in a follow-up email to everybody on this call. So you'll get a copy and then you can bookmark it and save it and refer to it often. If anybody has questions, please put them in the Q&A. We don't have any right now. There was one question that came in before the call, Kim, and maybe you guys could speak to it a little bit. It's a question I get asked often, but what is the best way or a good way to reach out to a district to let them know that you're interested in being a mixed delivery partner?
So as Corinne had mentioned in one of the slides, every community is different. So there's really not a one size fit all response. So I think knowing your community is really critical and knowing how your district operates. So I think there's several different methods of interaction. And actually, I know there's some providers on this call that contract, so they may have more insight than we do, right? But I think you could call your superintendent to express interest. If there's an early childhood office, some districts have a Department of Early Childhood Education. Most have a director of curriculum and instruction, reaching out to them. And then obviously you could always go to a school board meeting. They are public and there's public comment. So if your district is a PEA program, you could always go and introduce yourself at the public comment to the board and let them know you're interested. If your district is not a PEA funded district and there's interest in your community, you can go to a board meeting to express that your community is interested in being a PEA district. But as Corinne mentioned, I think what's really important in your interactions in those first steps in meeting with the districts is to kind of read this handbook so you understand the program. And when you're coming to talk, you're prepared. You know what the square footage is. You know that at the point of contracting, you need to hire certified staff, right? So that you know. And if you're currently serving children from that community, to have that data. Superintendent X, we currently serve 25 district 3 and 4 year olds. We have children whose families are using our center. So I think it's individualized, but I think those are some of the approaches.
Thank you for that, Kim. Any of the providers on the call have any suggestions for that, to answer that question? Unique ways you've connected with your school districts about collaborating?
Hi, my name is Marguerite. I was going to say the one way I did collaborate with my district was go to the building principal level first, get them to buy in, and we do the research together, and we present it together to the superintendent. That gave me so much more leverage than me going by myself as an independent partner, as a private center. And it worked out well because we built a relationship. I understood their language, and I did a presentation. It was a lot of work to get them to buy into it. I did a whole presentation on why it's beneficial. I did my research on the data in the community, and it worked out great in my favor. So this is our first year doing it, and I love it. We're trying to expand to two classrooms next year. So hopefully that will work itself out. But I would say go in at the tier level, start with the lower level, then move your way up to the superintendent, just to have some leverage because we are not an employee of the school district. So in order to build that relationship, go through the hierarchy.
That's great. Thank you so much for sharing that, Marguerite. I've also worked with parent groups too that kind of get some parent leverage, and they do the research together and then they take it to the school district. So that's also been another successful way of connecting with a school district. But I want to echo something Marguerite said, is it's about building those relationships, right? So much of what we do is all about those relationships. So leveraging those making friends with those you don't are definitely a good way to get your foot in the door. Does anybody have any other questions? No? All right.
Cindy, you can reach
Yes.
out to us if something comes up. You can
Absolutely.
reach out to us.
Absolutely. I will. I want to thank you all so much for your time today. I appreciate you being here to answer those questions directly.
We appreciate the opportunity, and we also just want to thank the providers. As when we first started, I saw some providers I knew from 25 years ago. So we really do appreciate your commitment and dedication to offering quality preschool. And, the program wouldn't exist without your partnership. So thank you for what you do.
There is a question. Actually, a question just came in. So don't go away just yet.
How could I have been doing this 25 years ago? No.
Okay. Okay. 2 questions. Can you provide a quick summary of the 3-year extension amendment? And is there anything we should take into consideration about that?
The multi-year contract?
I believe so, yes.
I'm going to actually punt this to Mickey.
Thank you so much. And let me just give a little background also, really quickly, a little plug. So 2 days ago, the department released the 2 templates for one for childcare, one for Head Start, in addition to the up to 3-year amendment. So they're all living on our website. All of the districts have them. There are some timelines attached. So if you are interested, what the legislation had, the same bill we spoke about earlier from July, also mentioned that contracts can now be extended up to 3 years. If you are interested in having that conversation, you would want to, approach your district, because your district, they're going to need to talk to you about the contract, right? So when you have that conversation with them, and if you're interested in just keeping things generally status quo, other than rates and perhaps enrollment numbers of children, you can use that template to guide the conversation. And if they're going to extend your contract, those are going to be due generally in our 60-day timeline. So by the it's April 27th that those are due. If your district is making any modifications to the template, though, they are not going to be able to use that 3-year amendment, and they'll have to go through the modification process. Those are due back to us by April 10th. So I will say, and I've said this before also, if your district is modifying the contract and they come to you, they have to have you fill out an attestation form also, right, that attests to the fact that they have discussed any type of modifications with you before they send that to us, and you have to sign it. The district sends that back to us. So that's your opportunity. If you have any comments or questions about the contract or reservations, that's a cue for you to write it on that attestation sheet, because I can tell you 95% of the attestation sheets that come back to us have no comments from the providers. So we don't know what you're thinking. And we have to approve those modifications. So we want to hear from you. So if you have any concerns, comments, good or bad, that's your place to write to us, because we look at those before we make decisions about the modifications.
Excellent. Okay, everybody got that? So you do have a space to ask some questions about the contract. So keep that in mind. Again, I'll put that out in a follow-up email. There are a few questions coming up here now, so I'm glad you guys didn't hop off too soon. And if you could clarify something for us, is it true that Abbott districts must now open collaboration beyond the currently contracted centers to those not currently with a contract? It's already difficult enough to maintain numbers. I have not heard that.
No, I think what that is the confusion about doing due diligence.
Yeah.
Right? Like districts have to do due diligence for serving children. I don't believe there's been a directive per se, but just like every district, we want to make sure we're serving children who are not accessing the program.
Okay. Any talk about allowing additional funds for capital improvements? For example, we have to expand or add outdoor play space to fit new district classrooms. We make it work now, but more space would help. And I guess the capital is something that might be holding them back.
So EDA had funding. I don't know if they're going to have new funding for providers. This is really more of a facilities question than it is a PEA question. So I would really, Cindy, if you can send me the question, we can see if we can get more information.
I will, absolutely. And so there's one question here that I'm going to start with, but then if you have more to chime in on, you can. What does room size have to do with the quality of care a center can provide? As an older center, I have one classroom with the district and unable to contract for additional based on room size. First, I want to say that they did change those space requirements to 42 square feet per child, and they did go ahead and drop the minimum number of children in a classroom away from 15. So if you do have a smaller space that's, say, licensed for 10 or 12 and meets 42 square feet per child, you can add that classroom on. It is a standard of quality that's a national best practice. So Kim, if maybe you can speak to that piece a little bit, that would help me out.
So, yeah. So, the square footage is something that is seen as another standard of quality, right? You have curriculum and things, but you also have the room. So you want to have enough space for children to move, to have ample materials, supplies, etc. However, as Cindy mentioned, the requirement for square footage did change. So it is no longer 950 square feet classrooms. It is now based on 42 square feet per child. So that means that classrooms that could not be used in the past now have the ability to come online to serve additional children. If you're 42 square feet times 15, which I think is 630. I'm not a mathematician. I'm not a tech person. I'm not a mathematician.
Right, 630.
So if your classroom is under 630, it's 620. you would be able to use that classroom for 14 children. You couldn't put 15 in, you could put 14 in. So it does open up more classrooms to be able to be used. You still would need to meet the requirements. You need to have the teacher and the assistant and all of those things, but you can have fewer children.
Thank you, Kim. Here's an interesting question since the timeline recently changed for application. If my center is interested in working with the district, when should we reach out? That's a good question.
I'm sorry, is it for somebody who's applying, or is it for somebody who's already funded? I'm sorry.
Not funded. Not funded.
So the applications have already come in for next year. The NFO process already opened and is in the review process. So if we're going to do the same process next year, Mickey, when does that go out?
I mean, likely to be also in the same time frame, so to go out in the fall for the following school year.
Start talking now.
Yeah. Yep. Okay, great. I collaborate with 2 districts and they both told us they have no guidance from the DOE to execute 3-year contracts. I would direct them to the handbook and the new contract template, correct?
So that new guidance just went out. Also, again, just went out 2 days ago. So if the district has questions, they can certainly come back to us also, and comes back to my office. And they have their attorneys as well who to help in interpret, but we're available for questions always. So again, it's up to 3 years, just to clarify.
Thank you. Okay. Is it still 15 student max per classroom, even if the classroom is bigger? Yes. No more than 15 students.
No more than 15 students.
Okay. I have to read through this one. We might need some clarification on this one, and it was anonymous. So if you can clarify it. Is there any way through licensing, which oversees all private providers, they could send their recommendations based on their observation of sites to the Board of Education in the district? So I'm thinking you want your licensing report to be seen by the Board of Education, and I would share that yourself. You could definitely share your licensing inspection report with the Board of Education. There's nothing stopping you there. I hope I understood that's correct.
Yes, and on our website, along with DCF, we do have the link to like the child care locator and the other DCF. So districts can link on and see inspection reports and things themselves. So it is available on the website, but I think Cindy's right. If you want to highlight your center and your report, you could certainly, when you're reaching out to the district, share that with them.
Right. Right. And the same for if there's things that need to be addressed or remedied that are in the report, you could use that as justification. This is a good question. Is there a recommendation for the per pupil amount districts give to private providers? We work with multiple districts and the per pupil amount is different for all. Wondering if there are some guidelines for districts to make those numbers. So what I can tell you is there are baseline numbers set per county, and then the districts adjust from there based on the overhead that and support that they give to the provider, the preschool instructional coach, if there's transportation, the nurse, the PERS, and anything like that.
So let me back up. Transportation shouldn't be pulled from the per pupil for the provider. The transportation should not be pulled. The other things, yes, those district-wide supports, nurse, PIC, PERS, etc. That is part of the withholding. I just want to, Cindy, just say that you have to realize that the salaries play a role. So if you have a district who has PICs who only have 7 years of experience, their salaries are less than a district that has PICs who have been are 25 years, right? The salary scales are different. So you may see differences that may be part of the difference between 2 districts.
Thanks, Kim. That's helpful. Couple more really good questions. If we were approved for the 3-year extension, does that mean you can't add more classrooms in that time frame?
So the 3-year amendment is still going to be turned in every year because there are going to be changes for enrollment, and also funding is going to change annually, right? Because the costs change annually. So they're still going to have to turn it in. So this just gives an opportunity to extend the current terms, but there will be some room for enrollment and funding changes.
Thank you. That's helpful.
Add to that, we've heard from providers that having the ability to have multi-year contracts gives them a little bit more support if they want to try to secure funding and other things. So this gives a little bit more support that the district is intending to have a 3-year contract with you. But to Mickey's point, the numbers could change. They could add a classroom. The provider could say, I want to drop a classroom, whatever happens. So those will be done yearly, but you have that 3-year, up to 3-year possibility.
Thank you, Kim. That's very helpful. And Mickey, yes. Here's a good one. Has the funding formula changed for districts who started this past September? We had an agreement with the district, but they were only given a percentage of total budget, so could not partner with us for the year because they couldn't cover the difference.
So part of the legislation that I referred to in the presentation, there is a pilot, a 3-year pilot, which has a cost share. So districts who were funded for 25, 26, 26, 27, and 27, 28 have to do a cost share where the state is providing about 40% of the cost and the district has to put in about 60%. It's a little different, but that's the round numbers. Mickey, I don't know if you want to talk to the second part about not being able to contract, or if we just want to get some more detail from Cindy later.
So if you're referring to the new programs that just came on board for this school year, then they're a part of this pilot that Kim just mentioned. But the other programs that have been in existence are not. They are still 100% funded. So I guess we would need maybe some more information.
That's fine. I can get that for you. And just a reminder to everybody, that is a pilot. So they're watching very closely the stats and the data and tracking how the pilot goes with the cost share to see if it's something that they're going to continue doing.
And Kim, it's a 3-year pilot.
Yeah.
Mm-hmm.
Okay.
And there's a steering that was required that will be reviewing all of the data.
Right. Thanks, Kim, for that clarification. That brings me to the end of the questions for now. So
well,
I'm going to thank you all for joining us. I think this was an excellent call. I'm really happy that you were able to be with us and bring all of this clarification to providers.
Well, we're happy to be here, and we hope you all have a wonderful day. And let's hope, well, if you like snow, I hope there's more snow coming. And if you
no,
none. I'm on the none side.
nada.
Don't say that, Kim. Don't put it out there.
I think we all had more than our fair share this year.
All right, have a great day, everyone.
Thank you, ladies.
Take care. Thank you.